Thanks, Joanna, and good afternoon, everybody, and thank you for the opportunity to speak to you all this afternoon. As Joanna said, my name's Mike Mawby. I'm the Programme Coordinator for Safe and Together here in Highland, and I'm probably the new kid on the block. I took up my post in July of this year, so we're kind of 5 months into the programme here. My post and the funding for my post and the training here is entirely through the Delivering Equally Safe Fund, administered through Improvement Scottish Service and via the Scottish Government. So we're a bit late to the party up here in Highland, but I want to pay tribute to Joanna and Kirsty from the Improvement Service and to Anna and her colleagues from Safe and Together, in that the networks that they have established and the contacts that they have provided have been invaluable to me, but also inspiring to hear from colleagues, not just from Scotland, across Scotland, but also from the rest of the UK, and the innovative and exciting ways that they are using the Safe and Together model has been one of, for an old hand such as myself, has been really exciting to listen to and inspiring. I want to talk to you about us as new people, as newcomers to this programme, about our experience, but also highlight some of the strategic issues that we're beginning to look at. So it's probably useful for you to know that interestingly, my post, although I am directly employed by Highland Council and I sit under the care and learning remit, officially the Safe and Together approach and my role are under the direct governance of Highland Child Protection Committee and the Highland Violence Against Women Partnership. So that's who I answer to, and Safe and Together now has a fixed agenda slot on both of those forums in terms, so it's I'm regularly required to provide updates. But crucially for me in my role, what that does do, it gives me a direct input into key personnel and within key stakeholders and key services here within Highland to raise the profile of Safe and Together, to enter into dialogue with those key agencies and services, but probably most importantly of all, to get the buy-in and the support of senior management from those agencies. As colleagues from North Lanarkshire have mentioned, this is quite an intensive programme. It does require quite a high level of commitment from staff and from teams in order to release staff to attend the training. So it's essential that you have the understanding and you have the commitment and you have the backing from senior management from across services to facilitate that, to emphasize that this is an important resource, and to give staff the opportunity to get involved in that. So that, for me, even just 5 months into the role, has been invaluable and something that I've wouldn't been able to move forward in the way that I have already. So using the networks that Anna and Joanna and the Improvement Service things, I started off by speaking to lots of people from across other areas in Scotland who are a lot further down the Safe and Together journey that we are, conscious that Delivering Equally Safe funding is 2-year funding and we're already in year 2. I was conscious of the pressures on us to start to deliver. So one of the first bits of advice that I got from colleagues across Scotland was to look at targeting agencies. And so what I did was, through the committee and through the partnership, was I targeted social work colleagues in children and families, but also within criminal justice, targeted colleagues from Police Scotland in the public protection unit, but also women's aid staff and education staff, crucially child protection leads within education, and also finally health colleagues, health visiting staff. Essentially, the advice that I was given was to look at those key personnel who work together and are operating under the remit of a child's plan, and particularly those who would be delivering key services to children under the auspices of a child's plan, and those with the potential to be lead professionals within the context of a child's plan. So I started on a program of engaging with these staff and with these teams, and we began to identify personnel to that. I was delighted that the first round of training that we had just the week before last, we just finished. We were oversubscribed on the core training for practitioners, which was excellent news. And on the managers and supervisors course, what was really encouraging to me was that we had managers from the teams, from the individuals that were attending the practitioners course. So we were getting that mesh together, we were getting that common thread there and the same messages across. Engagement from the staff, both the practitioners and from the managers and supervisors, was really good, really engaged. As folk have said, it is a huge commitment. All our training was delivered online by colleagues from North America. So that meant the practitioners were having to attend 8 half-day sessions, and we had a 2-week gap for half term within the middle of that. And for the managers and supervisors, it was 6 half-day sessions, again with that 2-week gap. We had hardly any dropout rate, which for a course of that intensity and of that duration, in my experience, is almost unprecedented. We've never had that. The other thing, I sat in on all of this, pretty much all of the sessions. And for me, one of the really interesting and engaging bits of it was that how much folk were engaging, not just engaging, but actually thinking about the programme and about the model in their day-to-day practice. And that involved them asking some very difficult questions of me in terms of how is this going to fit with what we currently do, and how is, well, if we're going to do that, then we need to change this, and why isn't this agency involved? Why aren't there people from housing? Where's the procurator fiscal? Which I thought was really good and encouraging for a first step. That was, people were thinking, they were beginning to internalize the program and thinking, right, okay, this is really useful training, but how am I going to implement it? So we've just completed it. Next week, I am holding a debrief and feedback session, because key for me in my role, and where the decision was taken to sit it under both the Violence Against Women Partnership and the Child Protection Committee, is so that I can be the conduit between the training and the learning from the training through to chief officer groups and the like, to begin to think about what areas of practice might we need to change, what policies and procedures might we need to review and amend to enable the implementation of the Safe and Together model and begin to embed it across the piece. So our meeting next Monday will be the first of that. I think it's fair to say people are quite excited that I'm offering people the opportunity to physically come together. I think after 2.5 years of COVID and all online stuff, folk are really looking forward to the opportunity. And I think one of the really other things that I've really enjoyed, and this goes back to my pre-GERFEC days, is the opportunity to bring people from these different agencies together. And that's been really interesting to witness, the engagement across the piece, the learning each other, and the beginning of the breakdown of the silos, and the beginning of the dialogue between the agencies, and the appreciation across the piece of, oh, okay, now I have a better understanding why the police, why you are taking this approach, or I understand the restrictions and the barriers on the likes of a health visiting team. So that's been really interesting and useful for me to hear, and I'm really looking forward to next Monday's session. The other thing that I think, again, I wasn't expecting, but I'm delighted to have seen, and colleagues from North Lanarkshire mentioned this, I promise you, I haven't prompted, I haven't gotten people to think, but people are already beginning to make the links to other strategic and other policy developments. So people are already talking about Safe and Together in terms of not just GIRFEC and how we operate GIRFEC in Highland, but also under the terms of the promise and the commitment of the different agencies in Highland to meeting the ambitions of the promise and how that links within that. Highland have a really strong commitment to ensuring that agencies across the piece are trauma informed. And again, people are grasping many of the tools within the Safe and Together model and thinking creatively and actively about how that helps them become trauma informed. But equally are saying to me, oh, I really think it'd be really good if this agency or this service had access to this, which again is really encouraging. I've also linked in with colleagues from the council and from our leisure and recreational arm's length service here who are moving towards accreditation under the Equally Safe at Work scheme. And again, they're very keen to get involved in this and are using elements of the model to evidence their accreditation under the Equally Safe at Work programme. So it's making those links across the piece. It's kind of joining up all of the dots. I think the other area that has been really good that folk have appreciated, whilst it is a demanding programme in terms of time and commitment to undertake it, there is an appreciation from staff and from managers of the investment in the workforce. And again, you know, people are really enjoying the programme. You can see the energy, even be it online, you can see the energy in the room from people and the engagement that they are having. So all of that is really positive. There will be challenges in terms of we are going to have to look, and I know this from colleagues across the piece in Scotland, but elsewhere in the UK, that we are going to have to think about some of our existing policies and procedures. We are going to have to, it is going to challenge us on some of our existing practices. But again, I think people are up for those discussions. I think people are willing to have that. And, you know, at the minute so far, I'm pushing at an open door. So all of that is looking positive. The big issue for me and kind of the area that I'm turning my attention to is, as I said, my post and the training for Safe and Together is entirely due to the funding made available from Scottish Government through Delivering Equally Safe. That funding ends in September. So we're hurtling towards, so effectively we've got 9-10 months of funding for my post and to delivering the training. I've got a full training program set up for next year and buy-in from that, but I'm now engaging with the governance bodies, with the Child Protection Committee, with the Violence Against Women Partnership and the chief officer groups attentive about sustainability. What happens beyond September 2023? You know, is there a commitment from Highland? Can there be a commitment from Highland? I think for me, one of the big issues is around all these strategic links that we're making. The ability the model provides for us to enhance our approach to GIRFEC. The opportunity it provides us to meet many of our ambitions under the terms of the promise. The absolutely key and vital tools that the model provides to help agencies across the piece here in Highland become trauma informed. Adjacent to that, initiatives like Equally Safe at Work that we can provide. The model provides us with real hard evidence in terms of what we are doing to keep communities safe, to protect women and girls within our communities here, as well as the broader issues about better interagency working, better cooperation around the piece, a real and honest demonstration of agencies' commitment to continuing professional development of their staff groups and the investment that they are prepared to put in there. I'm conscious that the economic climate we are currently in is not a good one, and it's not going to get any better for some time to come. I'm sure Anna won't mind me saying, but Safe and Together is not a cheap resource. But so I need to demonstrate to leadership across the piece here in Highland that this is worth the investment, that there are benefits, that whilst it's predicated around domestic violence and violence against women and girls, that are actually the benefits to Highland, to children and families and the wider community across Highlanders of us investing in the Safe and Together model, of embedding it in our practice across all the various agencies, of spreading the word, of raising the awareness of violence against women and girls within our community, and providing staff on the front line with real effective tools to manage and make better the lives of children and families. It is one that's worth investing in. So watch this space. Wish me luck as I make these arguments. And as I said right at the beginning, I can't thank the Improvement Service and the Safe and Together Institute highly enough for all the contacts that I've made. And I wouldn't have the confidence to be going forward making these arguments, trying to win the further investment beyond the DES funding if I didn't know that there wasn't the evidence out there from other areas about the huge difference that the Safe and Together model is making. It's a bit of a gamble through what we're doing. As I said, we're only 5 months, but we're getting there. We've made a good start, and I'm confident that we can continue. So thanks again. Thanks for the opportunity to speak to you all.